Okay, so let's have the other set of questions for prometry. So these are the some of the important questions. So let's discuss. While caring for a patient in post anesthetic care unit, that is PACU, so it is post anesthetic, who has developed hypovolemic shock. So all of a sudden, the patient is having hypovolemic shock, which means there is decreased fluid. Okay, so the nurse should position the patient. So this is also very easy, and it's very, 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 very commonly asked. Okay, so that is the patient has to lie flat with legs elevated. Okay, patient has to lie flat with legs elevated. So when the patient is having hypovolemic shock, we should make sure that the legs are elevated. Okay. In Chandralakbite position, no. With the head of the bed elevated at 45-degree, no. And completely flat, absolutely no. So it should be the patient has to lie flat with legs elevated. A patient has a vitrectomy and is about to be transported to the post anesthetic care unit. This is also a very, very, very commonly asked question. Okay, very important question. Vitrectomy is removal of the vitreous humor. Okay, where is the vitreous humor, by the way? It is inside the eyes. Okay, so inside the eyes you have vitreous humor and atrous humor. So these are the kind of fluids which is there surrounding the lens. So the patient has had a vitrectomy and is about to be transported to the post anesthetic care unit. The patient should be placed in which of the following position before transfer before which of the following position before transport to post anesthetic care unit. So the question is, what is the position? Okay, so a vitrectomy. So question is, for a vitrectomy patient, post anesthetic or post operatively, what is the position? The answer is prone position. This is very, very, very commonly asked for all your heart prometric exam. Okay, so you should always understand it is vitrectomy. If the patient has undergone vitrectomy, the position is prone position. The position is prone position. Again, while caring for the patient in post anesthetic care unit, which means again after the surgery, a nurse plans to keep the patient warm. So, okay, so this is what we have to keep the patient warm. What is the most important reason for this action? Why? Why should you keep? So, it is already said the patient is after the surgery, the patient is in the post anesthetic care unit. Why you should keep the patient warm? So this is the most logically correct answer. You patient will be anxious, so to decrease the anxiety. Preserve nutritional source, no. To lower the risk of infection, no. From the chill, there is no chance that the patient will get infection. This is also no. To prevent cutaneous vessel dilation. This again you can think, but again when it is cold, it is not dilation, it is always constriction. Okay, so the statement itself is wrong. So it is to decrease the patient anxiety. All right. A patient had a total abdominal hysterectomy and 2 days ago. So what is hysterectomy? It is TAH. Total abdominal hysterectomy means that is the removal of the uterus. 2 days ago and has not been out of the bed yet. The patient is complaining left leg pain and swelling. What should the nurse do first? So when there is something like this, the patient is bedridden, and so you should always see for the patency of the veins and the arteries. So it is a very direct answer. Okay, it is a direct answer. So we have a separate classes for all these signs. So please do attend the class, then you will understand what is Homan sign. So you should see whether the patient is positive for Homan sign. Okay, patient is complaining of left leg pain and swelling. So and the patient is bedridden. The patient is after abdominal hysterectomy. So we need to see whether the patient is positive for Homan sign. Okay, so there are certain signs which is very important in your from geometric point of view. So it is very important to study the sign also. This Homan sign is a direct indication of if it is positive for Homan sign, it means what? The patient is having deep vein thrombosis, which is a potential complication after the surgery. Understood? So when the assess the patient for Hoffmann sign. If the patient is positive for Hoffmann sign, it means the patient is at risk for deep vein thrombosis. Okay. To minimize a toddler from scratching and picking at the healing skin graft site, the nurse should utilize. This is very, very, very common. Just, put your common sense. You have a toddler and the toddler had a wound. It has got a wound. Skin graft is there. For sure, the toddler will try to scratch and pick. So what you can do? Will you give sedatives for this? No. Punishment? Exactly no. So again, the next filter is for distraction and hand mitten. Should we put mitten on? So mittens is the correct answer. Okay, mittens. The nurse is teaching the mother of a 3-month-old infant about bottle feeding. Which statement indicates the mother understands of appropriate procedure? I should hold my baby in a slightly reclined position close to my body. It is okay to prop the bottle on a pillow, which means if you can give the bottle in a pillow, which is wrong. It can feed my baby whole milk. You cannot give whole milk for a 3-month-old. Can you give cows whole milk for a 3-month-old? No. I should warm the bottles in the microwave if they come out of the refrigerator. No. If it is out of the refrigerator, you should thaw the bottle for some time. What is thawing? Thawing is bringing the room temperature, bringing the bottle to the room temperature. So we should thaw the bottle for some time and only heat the milk. So this is the answer. I should hold my baby in a lightly reclined position close to my body. Right? A 9-month-old child who has had 4-ear infection in the past 6 months. So past 6 months, so it is chronic. Okay. 4, it has had ear infection is discharged. Which statement by the parent indicates the need for further discharge teaching? I should never put my baby to bed with the bottle. So if the parent is saying, so you are the nurse, so okay, let it be you, and this is the parent. So they are going to get discharged. You both are talking. So she has a baby. This mother has a baby. This ma has a baby. The baby is repeatedly getting ear infection. So when the baby is bottle fed babies, when they repeatedly get ear infection, that is because of the, when the baby drinks milk, okay, this is the milk, this milk leaks out and go into the ear. So this could be a potential reason for ear infection. So you are educating the mother. So the mother is saying, I should never put my baby to bed with the bottle. It is right. You should not put. Okay. My child should not use a pacifier after age 6 months. Yes, no need of a pacifier after 6 months. Why? Because we say it will delay your teething. My child should drink his bottle while lying flat in my lap. No, this should be the answer. You cannot give while lying flat. You should have a head elevation. My child should not be around people who smoke. Yes. So this is a very, very direct question. You don't have to think something, isn't it? It's very easy. A patient complains of several severe menstrual cramping. So this patient is having, so your question is some pharmacology question, I guess. Yes. Bleeding is not unusually heavy and the patient has got no, okay, the bleeding is not unusually heavy. So it is not heavy bleeding and the patient has no uterine disorder. So there is nothing, no problem. Which of the following intervention should the nurse anticipate? So actually, the patient has got severe menstrual cramps, but there is no abnormalities related with that. So which will be the answer? The answer is it acetaminophen? Acetaminophen is our paracetamol. Or is it strict bed rest? Heating fat to the back of the neck. Why back of the neck? Or ibuprofen. So the answer for discomfort during menstruation is ibuprofen. And what does ibuprofen has or Motrin has? It has got acetaminophen, which is paracetamol, plus mefenamic acid. It has got mefenamic acid. So That is the reason. So mefenamic acid will reduce the spasm. During preoperative preparation of a patient for amputation of the left leg, the nurse has primary responsibility for. During preoperative preparation, so you are going to give a pre-op preparation and the patient is having amputation. So witnessing the patient's signature, yes, this should be their consent is an important responsibility. And you see, the nurse always witness. Okay, nurse will never take consent. Never take consent. The nurse will never take consent. The nurse will only witness the consent. So who takes the consent? Doctor takes the consent. Okay, it is never nurse. Nurse will never take the consent. Only doctor will take the consent. Explaining the procedure. Who explains the procedure? Doctor. Explaining the risk of the surgery. Who explains? Doctor. So this B also is doctor and C also is doctor. Making appropriate incision lines on the leg. Who does that? Of course, the surgeon does. So witnessing is the answer. 52-year-old is admitted to nursing unit from the physician's office with a diagnosis of cholecystitis. What is cholecystitis? It is inflammation of the gallbladder. Physician orders on admission include. So patient is going to have cholecystitis. Patient is having inflammation of the gallbladder, which is also known as cholecystitis. And because of that, the patient has come to the unit and the patient is getting admitted. So once the patient is getting admitted, since it is an infection, of course, the patient will have medication, isn't it? So what are the medication for the patients? IV ringer lactate. RL has to go IV 125 ml per hour. So it is IV ringer lactate. 125, so low calorie, low fat liquid diet. Low fat. Fat has to be low, liquid diet. Morphine sulfate 2 mg IV every second hourly as the need of pain. So for cholecystitis patients, their pain will be very severe. So morphine is the given medicine. What is the antidote for morphine, which causes respiratory depression? Naloxone. Not for sudden increase in the frequency. Okay, promethazine is again given for promethazine 12.5 mg IV is given for nausea or vomiting. Which of the following should the nurse plan to do first? So you have so many, options in that. You should find first one. Remove any high foods from the. It should be high food. This is high fat food. Okay, from the patient room. Okay, this also you should do, but not first. Notify the dietitian. Okay, you should do, but is it very emergency? No. Obtain venous access and start ringer. So yeah, you should give RL, isn't it? Because the patient is going to be on a low calorie diet. Obtain an emesis basin and clean lines. This also you should do, but not as an emergency, isn't it? So, sorry. So the answer for this will be you need a venous access and start the ringer lactate solution. So we will see in the next class.